Ever scrolled through social media and felt like everyone's obsessed with avocado toast? This trendy fruit has become a health food hero, packed with nutrients and delicious taste. But hold on a sec, before you mash up another avocado for your smoothie. Avocados, despite their amazing benefits, might not be a perfect fit for everyone. Curious to know why? Buckle up and get ready to dive into the surprising world of who should avoid avocados, and more importantly, how you can still enjoy this yummy fruit if you fall into one of these categories. Number 1. Kidney disease. Avocados are champions of potassium, a mineral essential for maintaining proper heart and nerve function. A single avocado boasts a whopping 690 milligrams of potassium, which is around 20% of the daily recommended intake for healthy adults. This is more potassium than you'll find in a banana. However, for those with compromised kidney function, this abundance of potassium can become problematic. Healthy kidneys efficiently filter excess potassium from the blood. But when kidneys aren't functioning optimally, this potassium can build up to dangerous levels, leading to a condition called hyperkalemia. Hyperkalemia can cause serious heart problems, including irregular heartbeats and even cardiac arrest in severe cases. Therefore, if you have kidney disease or are at risk of developing it, consulting your healthcare provider about avocado intake is crucial. They can help you determine a safe amount of potassium consumption based on your individual needs and kidney function stage. Number 2. Kidney stones. Another consideration for avocado consumption is its oxalate content. Oxalates are naturally occurring compounds found in many healthy foods, including fruits, vegetables, and whole grains. While generally harmless for most people, they can pose problems for individuals prone to kidney stones. When you consume oxalate-rich foods like avocados, your body absorbs some of these compounds. These oxalates can bind with calcium and other minerals in your blood, forming tiny crystals over time. In some cases, these crystals can accumulate and grow into larger stones, causing painful blockages in your kidneys as they try to filter your blood. The good news is that not everyone who eats oxalate-rich foods will develop kidney stones. Many other factors contribute to stone formation, including dehydration, specific medical conditions, and family history. However, if you've had kidney stones in the past or are considered high risk, be mindful of your oxalate intake. Here's the key: moderation is your friend. Instead of indulging in a whole avocado at once, use smaller portions as toppings for salads or sandwiches. Additionally, pair your avocado with low oxalate foods. Remember, staying well hydrated is also vital. Drinking plenty of water helps flush out excess oxalates and other stone-forming compounds, reducing your risk of kidney stones. Number 3. Tummy troubles. If you're among the millions who struggle with digestive issues like irritable bowel syndrome, IBS, or fructose malabsorption, often referred to as FODMAP sensitivity, you might need to be cautious with avocados. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are short-chain carbohydrates that your small intestine struggles to absorb fully, leading to digestive distress in some people. Avocados contain two types of FODMAPs: polyols in the form of sorbitol and fructose, a monosaccharide. When these FODMAPs reach your large intestine, they can draw in water and ferment, leading to unpleasant symptoms like bloating, gas, abdominal pain, and diarrhea. While everyone's tolerance level is different, some people with IBS may be able to enjoy small amounts of avocado without trouble, while others might need to avoid it altogether. If you suspect avocados contribute to your digestive woes, try eliminating them from your diet for a few weeks and monitor your symptoms. Keep a food diary to track your intake and identify any patterns or correlations. If avocado seems to be the culprit, there are plenty of other delicious and nutritious foods you can enjoy instead. Number 4. Histamine intolerance. Histamine is a compound naturally produced by your immune system and also found in certain foods, avocados included. people with histamine intolerance have difficulty breaking down histamine, leading to a range of uncomfortable symptoms when they consume foods high in it. These symptoms can include skin rushes, itching, hives, digestive issues like bloating, diarrhea, and stomach pain, headaches, and even respiratory problems like nasal congestion or asthma. Several factors can contribute to histamine intolerance. Some individuals may have a genetic predisposition, while others may develop it due to an underlying health issue such as a gut imbalance or a deficiency of diamine oxidase, an enzyme responsible for histamine breakdown in the body. If you suspect histamine intolerance, talking to your healthcare provider is the first step. They can help rule out other conditions and recommend appropriate testing or treatment options. In the meantime, if consuming avocados triggers uncomfortable symptoms, it's best to limit or avoid them altogether. Focus on incorporating low histamine foods into your diet instead. Number 5. Blood thinners. Avocados, generally safe and healthy, can interact with specific medications, particularly blood thinners like warfarin. Here's why. Avocados are a rich source of vitamin K, a nutrient crucial for blood clotting. A single avocado packs around 28.6 micrograms of vitamin K, which is about 25% of the daily recommended intake for adults. For most people, this isn't a problem. Vitamin K is essential for maintaining strong bones and proper blood clotting. However, for individuals taking blood thinners like warfarin, consuming large amounts of vitamin K can interfere with the medication's effectiveness. Warfarin works by preventing blood clots, while the vitamin K in avocados does the opposite, potentially increasing the risk of dangerous blood clots. Therefore, if you're taking warfarin or another blood thinner, caution is crucial regarding avocado intake. You can either avoid them completely during treatment or significantly lower your intake to minimize the risk of complications. Number 6. Latex fruit syndrome. While rare, some individuals experience allergic reactions to avocados. These reactions occur when the immune system mistakenly identifies certain proteins in the fruit as harmful substances, triggering an allergic response. In some cases, people with latex allergies may also experience allergic reactions to avocados. This is due to the similar structure of proteins found in latex and certain fruits like avocados. As a result, individuals with latex allergies may experience cross-reactivity, where their immune system mistakenly identifies the fruit's proteins as those found in latex, triggering an allergic response. Symptoms of latex fruit syndrome can range from mild itching, tingling, or swelling in the mouth and throat to severe reactions like difficulty breathing, hives, or even anaphylaxis. If you suspect a latex allergy, consulting an allergist for proper diagnosis and treatment is crucial. They can perform skin prick tests or blood tests to determine if you have allergies to specific pollens and fruits. However, if you have a known latex allergy, the best way to prevent reactions is to avoid avocados altogether. Number 7. Oral allergy syndrome. Oral allergy syndrome occurs when individuals with pollen allergies, like hay fever, experience allergic reactions to certain raw fruits, vegetables, and nuts. Similar to latex fruit syndrome, this happens because the proteins found in these foods share structural similarities with those found in pollen, leading to cross-reactivity. In the case of avocados, individuals with allergies to birch pollen, ragweed pollen, or grass pollen may be more likely to experience symptoms of oral allergy syndrome after eating the fruit. Symptoms can include itching or tingling in the mouth and throat, swelling of the lips and tongue, and a metallic taste in the mouth. If you suspect you have any of these allergic conditions, consulting an allergist is crucial for proper diagnosis and treatment. Your allergist can perform skin prick tests or blood tests to identify allergies to specific pollens and fruits. If you found this video helpful, don't forget to like, comment, and subscribe for more insightful content. Thank you for watching.